So is this the third session in your series?
Yes, it is.
Okay, so we've covered business and
economics, and we had law, IR, and political science yesterday.
Okay, okay, great, great.
Awesome. So now I think we can get started. It's 6:05
Let's
and
do
we
it.
probably have a
Let's
couple
do
more people join in through the session. But
Okay.
everyone here, thank you so much for joining. I wanted to introduce you to Sona. She works with a lot of our medical applicants on the UG side, and she will kind of be giving all of us an overview on, what it takes to be a competitive applicant and brief us a little bit about the process of applying for medicine. Over to you, Sona.
Okay, thank you so much. Okay, so I'm going to start sharing my screen. Yeah, I hope everyone can see this. Okay, so basically, okay, welcome to this session today, and I'm going to be talking a lot about medicine in today's session. So I guess, some of you, perhaps you've been thinking about medicine for a while. It's something that, for many years, it's been a passion of yours. And, you're now at that age when you are thinking about getting your application competitive and, getting into that process of applying. Or maybe, you have recently started thinking about it, something that, you have an interest in biology and you like the sound of medicine, you like the whole concept of, maybe caring for others. And now you're considering this as a potential, career for yourself. So either which ways, hopefully you will find something in today's session which will be useful. So what, as Nanika mentioned, what I'm going to be covering is I'll be covering, what does this career entail? So what does a doctor do? What are the different kind of, specialities that one could get into after medicine? And, where does that career lead you? And I will also be talking about, how to build a competitive application, how to put that through. So we've had a lot of experience, with medical school applicants. And so I'll share some of those insights with you as well. And also I'll cover a little bit about the content. So what are you actually going to be studying in medicine? And, what do your 5 years of medical education actually look like? So these are the 3 areas that I'm going to be covering. And the presentation that I'm going to be sharing with you today is mostly geared around UK. And actually UK is the country that we sort of suggest if you want to pursue medical education overseas. And so UK would be like our top choice. And, that is where we feel, and I'll give you some reasons why UK medicine is, very popular with students who want a good quality medical education. And a second choice could also be Ireland. So as this sort of graph shows you, the reasons why, we are focusing on UK primarily and also a little bit on Ireland is because both UK and Ireland are very open to providing or imparting medical education to international students. So this is not always the case in every country. For example, US and Canada, it's not, it is very difficult as an international student, as not even an international student, but as a non-US citizen or a non-Canadian citizen to gain admission into medicine as and when that medicine happens. So that's the first thing is, the openness of UK and Ireland. Again, I'll talk a little bit more about this openness. It's not that they are very open, but we will discuss that in a bit more detail in the next slide. But yes, they do like competitive students, and they may, they are very happy to accept really good competitive students. The second reason is that there is a direct entry into medicine in both UK and Ireland. So that means that right after class 12, you can get into an MBBS program. Again, that's different from, let's say, US and Canada, where you have to do an undergrad degree for 4 years and then you apply to medical school. So that way, again, Ireland and UK are very good. And the other thing is that the quality of education is amazing in the UK. In fact, it's like almost considered to be a gold standard for medical education. Similarly, there is the degrees that you get from UK and Ireland are very well recognized, and they are acceptable all over the world. So a little caveat here: wherever you want to practice medicine, you will have to do some qualifying exams. So, like you have a lot of professional courses like law, etc. as well. The country that you want to practice in, you need to basically get registered with their particular medical council, and that normally involves some kind of re-examination. So that, having said that, UK degrees are very well recognized all over the world. And lastly, the education is in English, which is again a very, very important point, because there are other places, for example, in the EU, where you could study medicine. The instruction, the lectures may be in English. However, a large part of medical education is clinical education. And clinical education means that you are going to be dealing with real life patients, and so local language knowledge is a very important part of a good medical education. So again, UK, Ireland, both, kind of trump in that, because it's the language of education as well as the language spoken in, in the country. So it helps in that way. So these are just some of the reasons, why we basically, give highest priority. If you're a good student, then we would suggest, UK and Ireland for you. So a little bit of, a little comparison, or talking a little bit about competitiveness in the UK and Ireland. So let's talk about the UK first. So there are 44 colleges in the UK, that provide medical education. So 44 medical schools as such. And the total number of seats for medicine is 10,000. However, for international students, there are only 500 seats. So you can see that the percentage of seats that are there for international students is low. It is only, it's 5% is the, and there is a cap on the number of seats. So it's not even up to colleges, but the General Medical Council basically has a very high cap, or I should say a very low cap for international students. It's capped at 7%. But overall, we find that there are only roughly about 500 seats. Of course, every year to year, this changes. And the acceptance rate for international students is less than 10%. So as you can imagine, it's a very competitive degree to get into. So, and that is actually true for medicine anywhere in the world. So whether you look at India, you look at US, in any country, medicine as such is one of the most competitive degrees to get into. Now, I've just given a few like little points there, like the deadline is 15th October. So it will be 15th October of the year that you are in grade 12, you will apply. And you will apply through UCAS, which is a UK, application portal. You can only apply to 4 medical colleges. That's all you're allowed to do. And you need to also take an exam called the UCAT. And there could additionally be another exam for a few other universities as well. But UCAT would be your main exam that you need to take. So that's a little bit about UK. I will discuss in detail on how a good competitive application looks like for UK. So we'll do that a little bit subsequently. But just to compare it with Ireland, Ireland only has 6 colleges. It's a much smaller kind of a system. And there are only, about 1,200 odd seats, total number of seats. However, the good thing in Ireland is that 600 of them are for international students, and this number is again being revised, and it's there is a talk of adding a lot more seats to for international students. So as you can see, percentage wise, it's very different from the UK. So there's a lot more seats over here, in total as well as a percentage. The deadline is 15th January again of the year that you're in 12th. So it's it's later, much later, 4 months later than the UK. And you apply directly to the colleges, or you apply through a consortium, so there's no UCAS. And another thing is that there is no exam for international students in Ireland. So the local students in Ireland need to take an exam for getting into medical school, but international students, they do not need to take an exam. So this is just a little bit of a comparison, just to give you an idea about the competitiveness of UK versus Ireland. So now I wanted to just share with you, I hope you can see the screen, the full screen, but anyway, let me just come to that in a minute. So the medicine pathway so I'm just using UK as an example. So when you get into medicine in the UK, you will be starting off with MBBS. So MBBS, that's the first, the first sort of rectangle right on your left-hand side. You are going to be called a medical student. So you're going to be a medical student. It's a 5-year program. In some colleges, it can be a 6-year program as well. So 5 or 6 years. Medicine is 5 years. Sometimes some colleges require you to do an additional degree in the middle of your medical education. And then you graduate with MBBS plus maybe a BSc in public health, or a BSc in, microbiology or something like that. So, but there are very few colleges, only about 4 to 5 colleges that do the 6-year program. Otherwise, it's a 5-year program. And what do you do in these 5 years? So in UK, a traditional college. So again, different colleges have different ways of teaching. And, the curriculum will more or less be the same, but how you're taught is different. So in a traditional college, you will have 2 years of preclinical studies. Now, preclinical studies is going to be mostly lectures. So you will be attending lectures on things like, you will study anatomy, physiology, microbiology, pharmacology, and things, pathology, those kind of things. So, so you will basically be learning everything about the human body, but it is not, it is going to be a lot of theory, but there is also going to be, in the preclinical years, you'll also have, some amount of clinical work, which will involve, dissections, going to, visiting hospitals, visiting a GP. You will be trained to do basic things like, draw blood and do an ECG, take blood pressure, things like that. So quite a lot of stuff, even in the first 2 years. Then you have your 3 years of clinical studies. Now, clinical studies basically is, another word for it is hospital placement. So you're going to be placed in a hospital. So 3 months, you could be in a pediatric ward. So you'll learn everything about pediatrics. You will see real life patients. You will be shadowing a doctor. And as you progress, you may be even doing a few minor things independently, or maybe not independently, but under supervision. Then so from pediatrics, you might move on to psychiatry, you might move on to gastroenterology, orthopedics, blah, blah. So you will basically, in the 3 years, in the last 3 years of your 5-year program, you are going to basically be doing a lot of hospital-based work. So and then you will still have your lectures, but they will be maybe once a week, maybe one afternoon a week. You will have, lectures. The rest of it is all going to be very practical, hands-on. But you are expected to study on your own everything. So if you are in the pediatric ward, you will need to know all the theory behind pediatrics. So all of that. So there's a lot of self-study as well that you need to do. And exams, every year you will have exams. UK has a very typical end of year exams, and you do those well and you progress on to the next year. So the exams are both a combination of theory exams where you're writing mostly multiple choice type of questions, and also what they call test of clinical skills. They are called the OSCEs, and those are exams in a hospital where you will have maybe actors who come and pretend to be patients, and you diagnose them, you suggest a mode of treatment for them and things like that. So very practical exams as well. So that's your MBBS. You are a medical student while you're doing your MBBS. Now, what happens after MBBS? After 5 years, you get into the UK Foundation Training Program. This Foundation Training Program is for 2 years, and it is what we would in India call an internship. So it is for 2 years. You are an F1 doctor or F2 doctor, and you are known as a junior doctor. So even though it is training, and even though you will be required to attend again lectures maybe one afternoon a week kind of thing, it very much feels like working, because you are not, there is no fees that you pay for the foundation training. In fact, you get paid for it. So just to give you an idea, an F1 doctor in the UK, an F1 junior doctor in the UK will earn somewhere around £28,000. An F2 doctor will earn somewhere around 35, 36,000 pounds a year, which is enough to sustain yourself. So there's not going to be any huge big bucks, or, you're not going to make the kind of money that, sort of like an engineer would at this age, or an MBA or something like that. But it's a good money and good enough to sustain yourself and a good standard of living. And also they, in UK, you are compensated very well for, stuff that you do, like an overtime or extra shifts and things like that. So that is the foundation training. Again, in the foundation training, you're going to be, you are basically going to be doing a lot of the work. So junior doctors in the UK work very, very hard. And they are required to take on a lot of responsibilities, and it's all hands-on. And then once this is finished, this training is finished, you are registered as, with the General Medical Council in the UK. And then you can do your specialty. Now, do you need to do specialty training? The answer is absolutely, you do need to. Because even if you want to be a GP or you want to do anything else in medicine, you can't practice as anything other than a junior doctor without the specialty training. So specialty training is a must, and it ranges anywhere from 3 years to, it could be for, some specialties and super specialties, it could be as much as 8 years. So 3 years, you can become a GP after 3 years, a general practitioner. And 4 years, most of the physician specialties take about 4 years. The surgical specialty could take 6 years. Super specialization could take 8 years. So it's a long process, but throughout the entire process, you are working, you are earning, but it's still called training. And then once that is over, then you become a consultant. So a consultant is like the highest level of doctor in the UK. There is really nothing more than a consultant. And you have to go through this entire grind then to become a consultant. Now, what kind of a consultant can you become? And, what are the different specialties? So this is just a little pictorial. So basically in the UK, what can happen is that, you either you become a GP. So GPs in the UK, general practitioners, are like family doctors. They have a very, very good sort of standard of living, I would say. They don't practice in a hospital, but they practice in clinics or in sort of GP practices, they are called. And you basically, you are the first point of contact whenever anyone has any problem, which is a non-emergency. So any kind of problem that I might have, maybe I'm having a pain somewhere, maybe I'm having I have fever, it's not going away, or I need immunization, or, I'm having some mental health issues, anything like that, the first thing that I will do is go to my GP. In the UK, every citizen in the UK, every resident rather, is registered with a GP. So I will have my own personal, GP. And then if the thing requires specialized treatment, then I will be referred to a specialist. So you either have a GP or then you have specialists. Specialists are normally hospital-based practice, and you could be a physician. So a physician would be someone who is, a non-surgical field. So you could have like a neurologist, you could have a nephrologist. So they're not going to do surgery, but they will basically diagnose problems, give you treatment for whichever part of the body they are specializing in. So it could be neurology, nephrology, rheumatology. Cancer would be oncology. There'll be pulmonology, someone who's looking at lungs and breathing issues and all that, etc. Obs and gynae, obstetrics and gynecology, etc. So these are all the physician fields. And then you also have the surgical field. The surgical fields could be, you could be a general surgeon, you could be a neurosurgeon, you could be an orthopedic surgeon, etc. So the surgical fields are also all, there. So these are just some of the things that you could be sort of doing, with your medical degree. So just wanted to say, if there are any questions, like I'll be happy, please make a note of them and I'll answer all of them after the presentation is finished. So, okay, so that was just a little bit about what you will be doing as a doctor and what does medical education look like. Now let's have a look and see, how does one get into medicine? So what is the process? What are the steps? And what does a competitive application look like? So it's a two-stage process for medicine, which is different from sort of other places, other kind of courses that you might want to apply to in the UK. Medicine, the first stage is your UCAS application. Like I said, that's an application which goes out. It's one of the first applications that, that any student will be sending out in grade 12. It has a deadline of normally around middle of October. So mid-October is the deadline. And basically the kind of things that you will be assessed on are your academic performance. So a lot of importance is given to academic importance, in particular on grade 10 and predicted grade 12 marks. So either your IGCSE, your 10th board, whatever 10th board you did, and your predicted grade 12. Some of the colleges also ask for your grade 11 marks, but they are not part of your UCAS application, but colleges may ask for it later. Now, when it comes to academics, basically subject requirements is that you should have both biology and chemistry. If you're doing IB, then both of these should be at a higher level. And also you either need, most colleges say that you should either have math or physics in your subject mix. They don't need to be at HL, they can be standard level. And in case you are of another board, basic requirement is biology, chemistry, and either math or physics. So, and a very high level of academic, academics is required in the stage 1 of the application. Now, the other part of the application, the other thing that you're assessed on is your medical entrance exam. So I'll just talk a little bit about this. So most of the colleges in the UK require you to take UCAT. So UCAT is the exam that you're basically going to be taking. So out of the 44 colleges, about 37 of them require the UCAT as their mode of assessment. 7 colleges require the BMAT, which is again from this year being phased out. So this is the last the last instance of the BMAT, and the BMAT will be replaced either by the UCAT or by college specific exams, which are to be decided. So the UCAT basically is an exam which tests you on things like, you know, your critical thinking skills. So it has sections like verbal reasoning, abstract reasoning, data interpretation, quantitative. So these are the kind of, you know, sections in the UCAT. And you also have another section which is called the situational judgment test, which is different from the, you know, from the first 4 sections. And this is basically looking at giving you situations and asking you to make a judgment. So what would you do in, and some of these situations can be medicine oriented and some of them can be, you know, just general life situations. So it's basically testing your, you know, ethics and things like that. So situational judgment, and then you have 4 other sections. And this is also a very important component of the stage 1 of your application. Another component is your motivation and interest. So medicine is, like I just showed in the last slide, it's a very long process. And you know, the person who's assessing your application, colleges need to ensure that you understand that, you know, what it takes to be a doctor. You are ready for, you know, this kind of long academic path. You understand, you know, you've given yourself enough opportunities to understand both the, you know, the good parts of this career as well as the challenges and the, you know, the difficulties that this career could have. So they want to make sure that you have the right reasons for doing medicine, and you have given yourself enough of opportunity to understand what this career is all about. So both of those. So these 3 things are assessed in the first stage. And I mean, if I was to kind of talk about what is the most important thing, definitely your academics and your medical entrance exam is the most important at this stage, at the first stage. Then we come to the second stage, which is the interview. The interview is as important as the first stage. So the first stage will get you shortlisted for the interview. And then the interview is going to then basically lead you to a conditional offer if you are successful. So most offers in medicine will be conditional, and they will be conditional to your achieving a certain grade in your final grade 12 exam. So let's talk a little bit about the interview. The interview will, you know, look at both motivation and interest as well as personality attributes and skills. And the medicine interview is very different from any other interview that you might have encountered so far, or any other interview that you kind of in your head, you know, okay, this is an interview. So yeah. So basically, I'll cover the interview in the next slide. Okay. So what is a successful medical application look like? So I've just given a little sample here. So in terms of academic performance, I've used the, you know, the 4 criteria that we have. So this is just a sample of a student, you know, who was successful in for the UK. So you need good grades for your 10th. So this student had 95% in the 10th. It was a CBSE board, and then predicted grades of 42 on 45. And then she actually ended up getting a 45 on 45 in her in the actual IB exams. Then her UCAT score was 2900 out of 3600 with a band 1 in the situational judgment test. So the situational judgment test is basically, you know, you're basically awarded a band from 1 to 4, band 1 being the highest. And then your UCAT score is out of 3600, and you know, getting anything above 3000 is very, very difficult. So even a 2900 puts you in the 98 or 99 percentile anyway. So it was an amazing score. And then now coming to the kind of stuff, so the profile building part of it, you know, that is basically captured in the motivation and interest. So as you know, for a good successful medical application, you need to show academic interest outside of curriculum. So how do you show academic interest? You can do additional courses. So this student, for example, did a course in neurobiology. She did a course in epidemiology. These were like, one of the courses was like a 8-week course. Another one was a 6-week course. She also did research in cardiology. So the research, basically what she did, it was quite interesting. She looked at, she went to a hospital, got permission to look at medical records. So she looked at, patients who had suffered from heart attack, a myocardial infarction. And she looked at their ECG graphs and compared the ECG graphs of patients with diabetes against patients who don't have diabetes to see what is, could she kind of find out some kind of correlation or some differences in these graphs. And she actually, did manage it. It was a good project. She got it published as well. So she did a project on that. She also worked with another professor to do a sleep project. And of course, she had her extended essay at school also, which she again spoke about in her personal statement. And she read a lot of, articles and books around medicine. So books could be sort of, fiction, non-fiction related to medicine, but a lot of research articles. This is very important in medicine because, very often in an interview, you could be asked to talk about, any kind of research that you have read about and etc. So a lot of students, may get subscription to journals like the British Medical Journal and things like that, so that you read, maybe an article a week or maybe an article a fortnight. And so by the time you are ready to apply or ready to interview, you have, a good few articles that you can talk about. And then the other things that you can do is, clubs and organizations in school, anything related to medicine, etc. So I know this student also wrote a blog on medicine. So she had a blog that she had been writing for a couple of years, and she picked up topics from her courses and her research, which she put on there. Then besides this, so this is all, good to have stuff. There are certain requirements as well, which is that, universities require you to do clinical experience. So you need about 4 weeks for a competitive application. You need 4 weeks of clinical experience. So what do I mean by clinical experience? It is basically shadowing a doctor or different specialties, doctors of different specialties in a clinical setting, in a hospital-based setting, where you look at the OPD, you look at the, you shadow them in the wards, you shadow them, hopefully, if allowed, in an operating theater, etc. So you basically understand, you look at the communication that doctors have with the patients, with other doctors, with, how they lead a team of, medical professionals, etc. So that kind of stuff. So that's one part of the requirement. The second part of the requirement is some care experience. So you need some care experience where you can showcase that you've actually, have, what it takes to care for someone. This could be physical care, or it could be even emotional care. So physical care, so maybe you're helping someone with a disability, or you're helping, like an older person who doesn't have good mobility. You're helping them to move, maybe helping them to eat, helping them to get dressed and things like that, or working with, maybe kids with, physical disabilities or learning difficulties and things like that. So these are the kind of things that they also need you to do. And this is good to do over a period of time. So where you maybe go in once a week, to some kind of an organization, etc. And you do it over a period of maybe 6 months, 7 months, something like that. So, and here they'll also consider things like looking after, like an invalid person at home. So it could be like a grandparent or something, or, helping them out with their day-to-day chores, etc. So this is basically, the part of profile building, so to speak. So after that, then when we are looking at personality and skills, that basically is assessed through the interview. So a lot of intense preparation, is done for the interview. Now, like I was discussing earlier, these interviews are very different from a regular panel interview. So some colleges do have panel interviews, which is what I would call a professional interview, where, maybe someone comes in, there's a panel of interviewers, and they ask you questions about why do you want to be a doctor, tell us about your skills, tell us about your experience, and maybe, different kinds of questions like that, which is a traditional interview. But more often than not, I want to say like 85 to 90% of colleges in the UK have a different interview format called the MMI, multiple mini interviews. And it is basically, it's kind of like a simple way to describe it might be something like speed dating, where you as a candidate are going to go from station to station. So each of those mini interviews is called a station. And so you go from station to station. Each college may have, anywhere from maybe 4 stations to 10 stations. And every station will have a particular question. So, or a particular case. So that could be, there could be simulations, there could be like a role play, there could be some actor who is, maybe pretending to be a patient who is angry. So how do you deal with an angry patient? How do you break bad news? How do you manage conflict? How there could be a communication exercise. There could be some regular questions as well. There could be some data interpretation that you may need to do. So each of these stations will have a different question or a different activity or a different scenario, which you will then need to answer. So, and then you move from station to station. So, traditionally, like before COVID, all the interviews were, you had to travel either to the UK for these interviews or sometimes, Singapore or Dubai or something like that. But now, thanks to COVID, they are mostly all online. And, so the past few years, we've been doing these MMI interviews as well online. So, a big part of preparing students for a good medical application is getting them to practice, this kind of interview taking. So, yeah, so I think that's about it from my side. I hope I have kind of covered everything that you were expecting. But of course, if there are any questions, I will be very happy to answer them. So I'm going to stop sharing my screen. So, if anybody has any questions, please let me know.
Hi, this is Dr. Kavita. I had a few
Hi.
questions actually.
Sure.
Hi.
Yeah.
So the one thing that I wanted to understand is that we do the basic medicine MBBS course, which may last for 5 to 6 years.
Yeah.
After that, don't they get to pick their specialty and then do their ST1 to ST7? Or do they still do a basic training for 2 years and then get on to, the specialty that they want?
Yeah. So yes. So after MBBS, so after 5 years, there is a foundation program. So how the foundation program works is that you could be anywhere, doing your MBBS degree, and then everyone who's graduated that year then will choose where they want to go and do their foundation. And the choice is based on location where you want to be, and also the kind of things that you want to cover in your foundation training. So somebody with an interest in pediatrics will do some, will maybe go to a foundation program with more emphasis on pediatrics, but you're still going to be a junior doctor. The specialization, like you said, the ST1 through ST8 comes after the 2 years. So 5 years plus 2 years, and then you get onto the specialty training program.
Okay, so this 2 years foundation training remains the same irrespective of what specialty you pick. It may just be molded according to your interest, depending on which hospital provides what course with what focus. Right?
Absolutely,
yeah. So the other thing is that I know this is really random and very vague, and it depends from college to college. But what are we looking at when we look at, say, MBBS 5 years in the UK? What cost factor are we actually dealing with?
Okay. So as far as cost factor is concerned, again, it depends college to college, but just to give you a rough idea. So like I said, MBBS, you are going to be having some clinical years and then some non-clinical years. So just the tuition fee in the non-clinical or pre-clinical years is going to be around the 25,000 pound mark per annum. But in the clinical years, it is going to be almost 50,000 pounds. And this is only the tuition, not the living expenses. Just roughly in the UK, we kind of suggest, 10,000 pounds a year as living expenses. But again, this varies vastly. If you are in London, it would be higher. If you are in, maybe in Aberdeen, it would be lower. So again, that kind of differs. But yeah, but I mean, of course, it is expensive, but as as against any other profession, you don't have to pay for postgrad. Even foundation years, like I said, there's no fees. So you are going to earn in the foundation year. So it's 5 years of investment and then hopefully, pay out.
So also I know that when it comes to, kind of once you apply as a specialty trainee, you have certain overseas scholarships. But I don't know if the same hold true for the undergrad. I know the post-graduation, there are a few foundations which used to a few years ago, but I'm not sure that holds true for MBBS.
Yeah, so no, it, for MBBS, it doesn't hold true that much. I mean, so there might be some organizations in India that might sponsor you, but the UK typically doesn't give, any kind of funding for international students. However, having said that, my student last year did get some funding, like a merit scholarship, so to speak, from her university. This was University of Nottingham, which was very unheard of and surprised me as well. But so some universities might give a little bit of funding, but as you can imagine, to expect the NHS now to do funding for international students is not really going to, not so much.
But that would be like some of them have a separate criteria, right? That you would have to apply for a scholarship, whether you were dependent or not dependent, and again whether the scholarship was given on the basis of your profile, your academic performance, or the extracurriculars, or it's a very vague line, so we don't.
No, so there is not, so like need-based scholarships are very rare. And based on your merit, you could get a scholarship. Like I said, one of my students did get it last year. But again, it's not going to be a huge amount of money, first of all. It's not really going to make much of a dent in the, in the actual educational outlay. But sometimes they do give, yes.
Also the UCATs, I mean, of course, they judge you on basically something which is similar worldwide. But, do they have a separate syllabus? Do they have a separate, format of the paper? Does the syllabus vary from the IBDP?
The UCAT? Yeah. Are you talking about the UCAT? So the UCAT has got nothing to do with, so the UCAT is not a kind of a subject-based test at all. It is very much to do with, so I would say it would be closer to like an SAT kind of a test.
Okay.
Like a SAT in the US or an ACT in the US.
So
nothing to do with subject. So the UCAT doesn't have any kind of subject component in it. The BMAT did have a science component, but that has been phased out. Like I said, the UCAT will be more like numerical ability, logical thinking, abstract reasoning, those kind of things.
Okay. So there's no science based, doesn't require you to kind of learn their no. And the only thing is, say that, you said that this, the girl who applied and her projected was 42 and then she got a 45. But what if the reverse happens? What then?
So basically what will happen is that, whatever your predicted score is, the college you will get shortlisted based on a good score. The conditions that you're then given to you as part of your conditional offer usually is lower than the minimum entry requirement for that particular college. So, and if you do not meet your conditions at all, then you don't get into college.
Okay.
I mean, you can, so, in medicine, they normally don't give a very, very high condition because they've gone through this entire process and really kind of sifted you out in this highly competitive process. So the conditions are not normally very high. So like, for example, this girl, she had a condition, even though her predicted was 42 or 43, she got a condition of 36.
Okay.
So, so the condition is not going to be that difficult, but if you don't meet it, then you can appeal to the college, but normally they won't give it, but you can appeal. Yeah, sometimes they do. Yeah.
What if someone has finished medicine and then wants to go abroad? Does the foundation course still hold true, or do you get to bypass that by a certain entrance or something?
So if you do, you can bypass 1 year of it. You will need to take the PLAB, which is the test required by the UK, and then you can enter as a F2 doctor, F2 junior doctor.
Okay, but that will not pay you again, right? No, that does pay you a small amount. The F2 training.
Yeah. The F2 also pays you. Yes. You do. You earn about something like 35,000 pounds as an F2 doctor. Okay,
and I'm sorry, I'm just kind of asking you all these questions because a lot of what you say are going to decide a lot of things. So I just wanted to know, we're just covering the UK today, but what about the US? Do you have can you throw any light on the US?
Yeah, so I'll do it very quickly. US is very difficult for an international student, a non-US green card holder or a non-US citizen. It's very difficult. So US, of course, you have to do your undergrad, which you will do as a pre-med track. And then you apply to med school. You take your MCAT exam after you finish your undergrad degree, you get into med school. And at that stage is where the big hurdle comes in, because very few seats in colleges are reserved or are, available for international students. So every college, even though they'll have a lot of seats, but international students, they might just be like a few, 1 or 2 seats here, there, and the other. So there is a huge amount of risk. So it's not like you can't do it, but it is very, very competitive. And very few international students actually make it. A lot of students, while they're doing their undergrad, may actually apply for a green card. And then that way, the other seats, the local seats are also available to you.
Okay, that makes sense.
And similar for Canada, very similar for Canada. In fact, Canada is even more difficult.
Okay, but that means 3 years of pre-med, then you do about 4 or 5 of med. And
4 years of pre-med, 4 years of medical school, and then you have your residency, which can be
3 to 4.
Yeah, 3 to 4. So overall, it'll be about the same.
Yeah, overall, it'll be about the same. Right. Perfect. Thank you so much.
Yeah. Hi, Sona. Yes. Sorry.
Hi,
Go
Sona.
ahead.
I'd like to ask.
Sorry, I'll get Sejal to, I think you've been, okay. Yeah, carry on, Sejal.
Yeah, Sona. I wanted to know that, once they have done their medicine in the UK, say up to their specialty. So where all are they permitted to work in the world? Because I believe the medicine degrees, that one has obtained from a particular country doesn't work in all countries.
So yeah, it doesn't.
So if you could throw some light on that, yeah.
Okay, so after the UK, you can work, so a lot of countries will have some exam that you need to pass. But I know for sure that from UK, a lot of, students go to Australia and New Zealand. So I think their systems are very similar. And so a lot of students from UK, after they've done their specialization, may go for a fellowship to Australia or New Zealand and then can work there. If you want to come back to India, you have to take an exam, and get re-registered or registered with the Indian Medical Council, the IMC.
So this exam that is there, that will be...
Sorry, carry on.
Yeah, this exam that you mentioned, is it like the NEET that they appear for, something a doctor can clearly give in, or how does it work?
It is the next exam. It is the, if you want to come back and work here, you want to do your specialization in India, then you need to do your next exam, which is, it's different from the NEET. It's, basically the syllabus is going to be what Indian students will study in their MBBS program. So it's like an exit exam. It's like an MBBS exit exam almost.
Okay. Okay, and that's what they need to appear for, even if they want to practice in the UAE or the US.
So the US,
similar exam?
For the US, no. For the US, you need to have passed another exam. Their exam, licensing exam, is called the USMLE, medical licensing exam, and that is a 2-stage or a 3-stage exam which you need to do in order to join the residency program in the US.
Okay, and for the UAE, would you be aware?
I'm not aware. No, I'm not aware, specifically about the UAE, but I do know a lot of. I think that there are a lot of UK qualified doctors that work in the UAE. So I don't think the UAE process is that difficult, because UAE doesn't have, their own indigenous kind of robust medical education system. So so UK and UAE, I think there is a lot of, kind of flexibility.
Got it.
Yeah.
And how difficult or possible is it for a UK student to go to do US for a specialty?
So you need to do the USMLE. It's an exam. It's a tough exam, but yeah, I mean, I know a lot of people who have gone to the US after UK, having passed that USMLE exam. So it requires
so even to study specialty, it's USMLE exam only that they have to do.
Yes.
Okay.
So USMLE is the exam between your medical school and your residency. And that is what you will need to do after you've done your MBBS in the UK.
Okay. Yeah. Thank you so much.
Hi, Sona. Thanks for that great overview. I'm Hardik here.
Hi.
Hi. Just a quick question. For the first year, I think we need to demonstrate in our bank account the XYZ amount of the tuition fee. But there are some schools which are asking for a whole 5 years. So could you just throw some light as to whether we need to show 1 year or 5 years worth funding?
Good question. I know for sure you need to show 1 year. I'm just trying to remember if my students have come up with this issue in the past. I think for medicine, you only need to show. Have you, is this something that you have found out yourself?
No, so for some universities in the US, sometimes have asked for 4 years worth tuition that you need to show. Just in your, and sometimes one of the universities have actually on the website, they've written that you need to deposit in the escrow account of the university, per se. But I think it's a rare, I think that's a rare thing.
I think that's rare even in the US, that's rare even in the US. However, I want to, so basically my students have only needed to show, either 1 year or, just 1 year fees.
Yes. 1 year fees. Okay. Fair enough. Thank you. Thanks.
Okay. Any other? I should actually look at the chat. I've not looked at the chat at all. Yes. So, thanks for that, Barnona. Okay. Anything else? Any other questions that I can help anyone with?
So Sona, hi, this is Barnona, and I have a question.
Yeah.
So, hello. Can you hear me?
Yeah, I can hear you.
Yeah. So my question is, one is the student applies for medical to a college, and scores, grades, all fine, and whatever the criteria is that you have shared, academic, extracurricular, non-academic, all of that is fine. But somehow, I just a little tricky one is somehow if the student is not able to get through medicine, get through medicine in the sense get through an opportunity of qualifying herself for a candidature or for a position of studying medicine in that college. So is it something like that? The college does give an alternative stance, saying that, okay, not medicine, but since your profile is whatever, good, bad, or standard, medium, whatever that is, and you can, your profile suits for a biochem or a neurobio or some other. So does this situation arise?
It does arise.
Or a biomedical sciences?
Because so it does. So so two things, like as an answer to this. One is that the UCAS, which is the UK portal, allows you to apply to 5 colleges. only,
Yes.
5 colleges. However, for medicine, you can only apply to 4 colleges. One of those
Yes.
applications
One
has to be
is
for non-medical. So
paramedic.
it could be biomedical sciences or biochemistry or whatever.
Correct.
Secondly,
Correct.
also, in order to answer your question, yes, colleges, if they like your profile, but they cannot accept
Yeah.
you for medicine because, you know, you didn't
Right.
make it through the competitiveness of it. They will offer you
Right.
some other course. Now, in medicine, what I want to say very specifically is that this is true for anything in the UK, especially for medicine. You cannot reapply for medicine next year. So you need to finish
Understood.
off. If you're studying in the UK, so you're doing, let's say, another degree in the UK, biomedical sciences, you need to finish that and then apply. So you either apply as an
Understood.
undergrad after 12, or you take a gap year and apply again. That is perfectly fine.
Correct.
But if you join a course and
Correct.
you finish that and then apply. So you can
Correct.
apply as a graduate as well. In fact, just to give you an idea, a lot of, you know, colleges have graduate entry programs as well, and
Yes.
graduates, basically they do a 4-year program instead of a 5-year program. So that also happens, or they can also, you know, compete for the same undergrad seats as well. So,
Right. But my question was that if the college doesn't, if the college doesn't find your candidature competitive enough for a
yeah,
medicine,
they will offer.
would
Some
they
of them
offer?
do. Some of them do.
Do.
Yes, they do.
So that
They
is on a case-to-case basis.
on a case-to-case basis. If they like your application and they feel there's something suitable there for you, they will offer it. Yes.
Right. That's it. That's my question.
Yeah.
Thank you.
Okay, great. Great. Any other questions?
Okay. One question, Sona.
Yeah. Yeah.
How significant it is for your research paper to be published?
Not
so required.
I would not put it as one of the main criterias. No.
Okay.
No.
It could
Getting
be a
it
value
published
addition,
is
but not a deciding criteria.
It's not a deciding criteria. It's not a make or break. No.
Okay. Fine. Thank you.
Okay, great. So assuming that we have no other questions, I think I just want to thank everyone for listening in and asking wonderful questions. And yeah, that's about it. Thank you so much, and all the best to all the students who are thinking about medicine. Okay, guys.
Thank you.
Sorry.
Thank you very much.
Hello.
Thank you so much, Sona.
Thank you.